Okay, so we are going to record this session. We're going to do that all the time. I'm going to share my screen again with you. Every time that we get together, you are welcome to tell me, Kathy, I did not see you start the record, if indeed I miss it, because this is the way that if you are sick or a loved one's sick in your household, or there's an outbreak and we need to quarantine, this is how you're going to be able to view what we did in class. Everybody's here today, but I'm going to go ahead and record it and post it, okay? Because you can revisit it later on. Excuse me for my dry throat. Okay, so welcome to class. Here's the agenda for today, what we're really going to talk about. A little bit about who we are. We're not going to get into a lot of introductions today. It's hard to do with 33, so I'm going to do that when we're in our face-to-face sessions to be able to get to know you a little bit better. But I'll get to know you too from our interactions and when you reach out to me. We'll talk about why community health is important very, very briefly, because this is not a lesson class. This is really going over stuff. What will class look like? Let's take a look at that syllabus and schedule. Both are very important to you, and you should be reading through those in all of your classes to understand what that instructor is asking of you. And then we'll take a little bit of a look at what each of the assignments are, so they're not a big unknown, because you'll notice if you go into Blackboard, you'll notice I've only opened up the first 3 weeks, and that's because I do not open up all the work for the 16 weeks or 15 weeks. I don't open that up at the beginning. It's way too overwhelming, and I reserve the right to kind of fine-tune as the class goes along, because we may have topics that are emerging that I want to talk about. And so I reserve the right to be able to kind of tweak that, but you will have your assignments and that week open up a couple of weeks ahead of time. And you can always reach out to me if you have concerns about that, just like anything else. And we'll go over some Q&As. So here's what I'd like you to do. In the chat, if you could put in, where are you at right now? Are you in your dorm room? So that's a dorm room. And earlier we were talking about the cats, you know, are you having your cat sit on your laptop because you're home and you're trying to do this at home? Is your dog wanting to go out and bothering you about that? You may have little sisters or little brothers running through the house, or even maybe in your bedrooms. A lot of students ended up secluding themselves in their bedrooms during the spring when we had to do this. So great. So some of you are at home, absolutely, and some of you are in your dorm rooms. Yeah. When we were talking this summer about whether or not students would want to come to all of their classes on a particular day, or if they'd want it spattering across, we really got to an impasse when we talked about whether that student was a commuter or whether they lived in a dorm. So great. So in a study room, that's great, Andy. I'm glad you're able to utilize that and participate in Zoom from someplace that's outside of your own place. Good. Okay. All right. And it looks like everybody's got internet that's working well, because I'm seeing stuff from everybody. Terrific. So we will get to know each other a little bit better, like I said, when we are together in our smaller groups. So a little bit about me. So this is me and my hubby, and we are Green Bay Packer fans. I am Illinois born and bred. I'm relocated to Wisconsin about 20 years ago. So I kept up my love for my Cubs. In fact, I can show you here. There's my W on the wall. So my love for the Cubs, but I did become a Green Bay Packer fan and owner. So we enjoy that. But I also have 10 grandkids. And they all are under the age of 11. So they are pretty crazy, and they all do live within a couple of hours of me. So I'm very fortunate and blessed that way. And then, you know, many of your faculty, if not all of your faculty, continue to work in healthcare, even if we're full-time faculty like I am. So I currently work for Penn State University. I am a telesane, which means I'm a telehealth sexual assault nurse examiner expert for rural community hospitals who may have someone, a nurse, an ER nurse, who has been trained in sexual assault examinations, but has not done them often enough or has not done enough of them to really understand all the different components. And so what it is that I'm an expert in the room, they're an expert in the room because they're actually there with the patient, and we have a telehealth visit during their sexual assault exam. Typical sexual assault exams last about 4 to 6 hours, and they are very patient-centered. So we'll talk about that later in our semester, about not only about telehealth and how that has been a boom since the beginning of COVID, and why we were well poised to be going to some of these virtual visits, thank goodness. But also the idea that when we're treating vulnerable populations, we really need to be patient-focused versus medical focus. And we'll talk about what the difference is between those two. When you're in acute care, it's very easy to be medical focused. You know, you have certain things you need to get done in order to get this patient to feel better, in order for them to recover. When you're patient focused, they're completely in control. I'm not saying patients shouldn't always be completely in control, but I'm saying like they get to, you know, they consent to something and then 2 minutes later they change their mind. That's absolutely okay. I got my big girl pants on, doesn't bother me a bit. We won't do that part of the exam. So we'll talk about that more when we get into it, but it's a very, very interesting job. I thoroughly enjoy it. I've been a forensic nurse for about 10 years, so we'll talk about that a little bit later. So why is community health important, and why do we even care about it? I know that your mindset, I've heard this from many, many students and actually other faculty, your mindset is on acute care med-surg, and it will be this semester. I understand that. You're really focused, many people are focused on getting that hospital job when they get out, or an acute care jobs rather than out in the community. But community health really became to the forefront with COVID, right? So we're still living it. You know, a health department comes out and says nobody is able to open up their school this term unless they do X, Y, Z. So we'll talk a lot about that, about why we need community health and why we need community health workers. Things like contact tracing are not easy to do, yet they are the basis of some of the decisions that we're making in healthcare. It really is important. Now for me, and I trust for a vast majority of you, the idea of community health is that we aren't always seeing our patients in the acute care setting. So this little boy may not have an acute care need to come in to see the doctor or into the hospital, but that doesn't mean he shouldn't have his health monitored, and he shouldn't have his health impacted by decisions we make, such as lead poisoning in the house because of paint, or environmental factors because of a highway going right past a school play yard where they're out playing, and the incidence of asthma, or nutrition, or an abusive home with parents that can't cope, or parents that are addicted to drugs or alcohol. We hear about that all the time. So community health really looks at our population and saying, how can we make the world healthier for the people that live in it, and particularly for the people that live within our community, whether it's a county, whether that community is considered a state, our country, or globally. So that's what we're going to be talking about. And we do, again, interact with people individually in that community, but we're looking at the overall, what's the mortality rate for COVID-19 or influenza or pneumonia or TB? How can we keep Ebola from coming over to our country? What kind of precautions do we need to take into place? Are we screening people often enough? That's where community health comes into play. So let's take a little bit of a look at what this class is going to look like. I'm sure this is on the forefront of your mind, and it might not be the first class you've had today that's talked about this, but we are in a hybrid model in community wellness. What that means is that we will have Zoom sessions like today, and those are are depicted well on your schedule, so make sure that schedule is something that you utilize. And then we have face-to-face, and face-to-face is going to look like what this classroom looks like. We're going to be 6 feet apart, we're going to be masked, and we're going to have half the class be able to do that. And so we are in Chemetz 006, so it's a nice sized classroom, but it looks very similar to what this one is. Again, I don't have the capacity in that classroom to Zoom half of you as I'm teaching half of you. So that's the reason when we are meeting face-to-face, you will only come one time. I will do a duplicate lesson for Monday and Friday's class, but you will only attend one of those. That's the reason for additional assignments that you may see on the schedule. Now, how are we going to break that class up? We went back and forth. Do we split the class alphabetically? Well, that doesn't seem very fair. You guys don't have any input in that. I'm not asking you what you want. You might want to come with a person. You might be, that might be someone in your intimate group, in your family unit, as we call it, if you're in the dorms. But if you're commuting, you may have somebody that you've agreed that you're carpooling with. You guys have already been around each other and you're going to do that. And so it wouldn't be fair for me to divide that up. So what I'm going to do is I will send out a simple email survey. It's not going to be SurveyMonkey. It's not going to be Qualtrics, nothing like that. Simple. I just want you to respond to me. I'm going to ask you, do you prefer Monday face-to-face class? Do you prefer Friday face-to-face class? Or do you really not care? It isn't going to impact your life too drastically, either one. I can't guarantee that I'm going to be able to honor everybody's request. And I have to have a set group of students on Monday and a set group of students on Friday. And the reason I have to do that is that we're expected as faculty to have seating charts after the first day in class, and that's for contact tracing. So if someone would come down with COVID-19, an active case of COVID-19, we need to be able to produce a seating chart that says this student was sitting amongst these other students. Now, we're going to still maintain 6 feet social distance in the class. We're still going to keep our masks on, but I need to know how to divide the class up. So I'll send that out probably by the end of the day today, just to you. Just respond to me. I'll start putting the list together. We'll see how that goes. As you can understand, we're in this together, and I can't make the room any bigger. And so I can't, if I've got 20 responses for Monday, I'm not going to be able to do that. I can fit about 18 people. I think the capacity, COVID capacity for that classroom is 18. So I can fit 18 people in. So I'll try to accommodate everybody. You may want to talk with your friends and decide if you want to go to class together or if it really doesn't matter to you. Okay.
And where will that be posted?
I'm going to email it to you, and then I will post it on Blackboard. Good question, Ashley. Okay. This is again talking about doing that. And Ashley, I'll let you know that's a perfect way to ask me questions, because sometimes I can't see the chat. So perfect. Thank you for doing that. Okay. I'm sure you've seen this like ad nauseum, like you're sick of it. Stop talking about it, Kathy. We don't need to hear about it anymore. But this is actually what you're supposed to be doing, right? You're supposed to be wearing masks at all times. They're supposed to be neutral, right? We're going to be practice good citizenship and have masks that are neutral, as far as no inappropriate things on the mask or something like that, a picture or something. Unfortunately, we can't do eating or drinking in the face-to-face class, which I just hate, because this class starts at 12:05. I always allowed students to be able to go ahead and bring your lunches into class. And I like to have something to drink during class. I mean, not something to drink, but you know what I mean. A little bit of water, a little bit of coffee, a little bit of iced tea. But we're just not going to be able to do that because we have to take our masks off, and the campus administration is asking us not to do that. Maintaining the 6-foot distance and making sure your exposure to someone else is less than 15 minutes. What I mean by that is, if you happen to pass somebody in the hall, or you happen to brush up against somebody as you're getting out of your table, that's a really minimal risk. You know that in healthcare. It's really the ones that are over 15 minutes that we're worried about. So that's the reason when you're sitting in your seats, we want you 6 feet apart. And we're going to minimize the time that we actually have people meeting in groups. We'll figure that out in the class. Entering and leaving classroom, please be cognizant of the other students. Please don't congregate out in the hallways. And then we are going to try to get done with class a little bit early. Yay, right? Everybody loves that. So that I can wipe down the classroom. I have to wipe down the classroom before our class starts, and I have to wipe it down after the class starts, all the high touch points. So we're going to do that. There will be wipes also in class if you want to, you're saying, well, I really don't trust anybody else doing it. I want to do it just like if you go to the grocery store and you get a cart and you want to wipe the handle off yourself, even though they said it was clean. You can certainly do that. Okay. And then, like I talked about at the very beginning, although everybody may not have been here, for community wellness, it's a class we can easily adapt to 100% virtual if we have to go there. We are all praying, and I don't mean that facetiously. We are deeply praying that we can continue to meet as a community and that we don't have to close down like some of the other universities have already decided to do. And that responsibility of how we do that lies on my shoulders, and it lies on yours to be able to follow the rules that are in place to keep us safe. And we don't just keep ourselves safe for ourselves, we keep ourselves safe for our loved ones and for other people, right? All right. I'm going to pause here. I want to know, are there any questions so far in what we've covered? Anything surprising or that doesn't make any sense or you're not really particularly happy with? No? Okay. Later on in the semester, you'll be happy to speak your mind to me. Doesn't bother me. You can speak your mind anytime. I don't mind. Okay, let's go back and share this. And now we're going to look at the syllabus. And the reason we look at the syllabus is because we want to make sure that you're looking at the roadmap for what's actually going on. Many times people will put that syllabus and the schedule in the same document. I just thought it was too long, so I actually divided them up. But we'll look at the syllabus first. Okay, and Gina, can you nod your head if you can see my syllabus? You can. Okay, thank you very much. All right, so this is in Blackboard. Both of these are in Blackboard, the syllabus and the schedule. And pretty much it tells you the different things for the particular class and that particular instructor. So this term, all of our office hours are going to be virtual. I ask that you make an appointment with me because I'm not going to hang out on Zoom for, 6 hours on Wednesday. And so if you want to speak with me, we can do it on the phone, we can do it via text, or we can certainly do it via Zoom. And actually, I prefer Zoom. I like being able to see people's face. I think we have a better communication that way. But if you can't do it via Zoom or you don't want to, we can certainly do email, text, or a phone call. I'm available for all of those. If you're taking notes, I'm going to post this on Blackboard, and I'll make a note to myself because I don't think I did it yet. But if you're taking notes, I'm going to give you my cell phone number because you can always text me or call me. And I'll put that on Blackboard too at the same place that I have the Zoom meeting. So my cell phone number is 920-296-1260. And the only thing that I ask with giving that to you, 920-296-1260, is that you would limit that to times when you're just really can't get to what you need to do. Let's say you've been working on a paper all day, the deadline is looming, you're having a problem with formatting or something, you just want to make sure it's okay with me or something like that, or you just can't find the particular resource. The reason I ask that email be our main way of communicating those kind of things is because I get email on my phone too, so I'll respond as I can. But I will try to respond as quickly as I can, but given the idea that if it's on the weekend or if it's in the evening, it might take me a little bit longer to respond. As I showed you the picture, I got 10 grandkids. Grandma is babysitting a lot to give mom and dad's breaks into my family because they've all been homeschooling and they're like ready to pull their hair out. So just use it judiciously, but you are welcome to use it. I don't mind that. I would rather have you reach out to me than to sit in front. I think that's the worst thing. Worrying about something. You're not going to be able to move on to something else. You kind of fret over it, and then you really, it kind of ruins your evening. So go ahead and reach out to me. Text, phone call, email, or we can set up a Zoom meeting. Okay? All right. So I'm going to look at my other monitor. I don't mean to not be looking at you, but this contains all the basic information up here. And then this is just, this orange part is about COVID. And, you have APA guideline. If you have the 6th edition, that's okay. If you have the 7th edition, that's okay. They're not that much apart. I'm not going to worry about it. But they're, both of them should do just fine. I will tell you the 7th edition is a little bit easier to understand. So if you have the 7th edition, that's great. But if you've got the 6th edition, don't go out and buy the 7th. I don't think you need it unless you want to. You can utilize either one for the stuff that we're doing. And then Caputi is a textbook you should have gotten, I think, last year, Caputi, or you're getting it this year. And that is really about how to think like a nurse, how to critically think like a nurse. I'm going to show it to you. Okay, and Caputi, I'm going to stop sharing my screen because you can't see me very well. So Caputi looks like this. Think like a nurse. Okay, so it should be familiar to you. If it's not familiar to you, then you can contact the nursing office because this is something that you should be utilizing now. We'll be using that for a couple of our assignments. All right. Okay. Then it has information here on learning resources. I'm going to go here for just a second. I did notice some of you have been turning in your pre-class knowledge check, which is fantastic. Thank you very much. If you click that link that I was just showing you, you get here and it talks about the technology of what you should have for your computer to be able to participate in classes this term. And I just wanted to show down here that it does talk about having Microsoft Office 365. And that is because regardless of whether you're on a PC or whether you've got an Apple computer, because you could have both, right? Or whether you have an Apple computer, you do need to utilize Microsoft Office products to be able to submit your homework assignments. So a couple of you, I think, for your pre-knowledge test used page, I think, and that doesn't come through. It just doesn't. It needs to be either in Word. If we're doing PowerPoints, it needs to be, if we're doing slideshows, it needs to be in PowerPoint, not Keynote, I think is the other one. They just don't go through on Blackboard. So that's the reason that's on here. So you should be able to convert those easily. If you have any, yes, Jacob, I see you.
I checked with IT today because I was trying to get that downloaded on my computer, but like Microsoft's things like down, so you can't download anything right now.
Okay.
I've been checking every hour to see when they get it back up and running, but it might be up right now. I haven't checked. But.
Okay. And so what I would say is that if you're waiting on that, don't worry about it. The pre-check is something that I use later in the term. I just want people to get it done before they start learning. So if you've done it and you haven't been able to upload it in a Microsoft product yet, then just do so at your earliest convenience, but it doesn't even need to be this week, Jacob. So thank you so much, because you weren't the only one. I know there were others that were doing that too, so thank you. All right, let us go back to the syllabus. All right, and then Respondus is something that we will be using for the final, so we won't be using it until then. Any of the quizzes and that you don't need to use Respondus for, but the information is in here for that. Then we go through course objectives. Here's our list of assignments that are graded. We will go over all of these before we're done today. And then, as you probably know, the grading scale has changed a bit from last year. And so what that means is that you still need a 79 in order to pass, a 79 or higher, but it has changed what you actually get for a letter grade. So all of our stuff will reflect that, okay? All right, so here's some things, just information on what to do if you're ill, that you can't drink. All this is pretty standard, all the nursing courses. So here we get to NCLEX prep. So both junior 1s and junior 2s are in this class. We have both students. And that's because you can choose this, right? You can choose when you want to take this in your junior year. And that's fine. Right now, though, that's a challenge. It's more of a challenge for me than it is for you. Some of you have ATI and some of you have Kaplan. I have 2 different assignments, reading assignments for those, and we're going to have to have 2 different testing times for those. But don't worry, we'll talk about it as we get later into the, as far as the testing, don't worry, we'll talk about it as we get later into the semester. I'm going to actually offer you several different sessions to pop in on Zoom and be able to take your final test in either ATI or in Kaplan. But it just is kind of a challenge that I can't assign the whole class to do chapter 1 for ATI or this particular section in Kaplan, because not everybody's got the same book, and not everybody's purchased the same. Both of them do the same thing. They prep you for NCLEX, and both do a very good job of that. But they can be cumbersome. I will readily admit both systems are kind of cumbersome. So if you have questions on either one, go ahead and reach out to me. But you should have received your books for that. All right. Behavioral expectations. I just expect you to be engaged when we're in either classroom or Zoom. I think that's just respectful. That's, you know, we just respect that out of everybody. Just be engaged, be ready and willing to answer questions. Don't be afraid to answer something because you're afraid to answer it wrong. You know, it's a very, very safe environment. I don't expect everybody to know everything about community health. So we'll make sure about that. Cell phones, pagers, and laptops. I don't even know why we put pagers in there. Does anybody ever carry a pager? I carried one for my last forensic nursing job. I thought it was so archaic. But as far as cell phones and laptops, if we're meeting face to face and you want to have your laptop open because you're taking notes, that's okay with me. I don't mind that. What I ask of you, though, is that you're not shopping, that you're not on the internet searching things. I don't care how boring I'm getting or you don't like the topic. Just be respectful and stay on task as far as that goes. I may walk around during class, but I'll tell you, I'm a little bit more limited. I shouldn't really admit this, right? I'm a little bit more limited in walking around the class because of recording it on Zoom for someone who may be home and quarantined than I am on a regular class. So I'm asking for your integrity in being able to stay on task when we're in class. And if you do have an emergency phone call, emergency text, I mean, we all have emergencies that happen. I'd ask that you step out of the room so you don't disrupt anybody else that's going on. If you're on Zoom, I ask that you, regardless how hard it is, it's hard for me too, turn that phone over, put it on silence, put it away for a little bit. And so don't be multitasking. I know we love to multitask. I love to multitask, but let's just stay engaged so that we can get through the materials in the most valuable way for you. Because this is, you know, the stuff you learn in these nursing classes impacts somebody's life later on. So it's not like I'm worried that you're not going to get statistics right. I'm worried that you might forget what primary prevention is, and then when that needs to be done during a screening process, you might not be able to recall that. So let's just make sure that we stay together. All right. We're almost done with the syllabus. It talks in here about excused and unexcused absences and what's expected. I'll tell you, I will always err on the side of an abundance of grace for you. So please be open and honest with me and let me know what's going on. If there is something that you need to miss, let's work it out. Don't be afraid to talk to me. Don't be afraid to reach out to me and say, I'm really struggling with this because I've got this going on. My mom just came down with, you know, cancer and I need to go home for a couple of days, or my kids are home and they, you know, we thought we had a babysitter for the afternoon and that's just not working out. I mean, let's just talk things through because this is a difficult semester for everybody. And so let's just work it out. I want you to pass this class, honestly, and I want you to pass it successfully, not just get a grade. I want you to really retain what's in here. So grading of assignments, I won't be grading. If you turn in an assignment early, I won't be grading it early. And that's because a lot of times when instructors are grading papers, they're really kind of contrasting and comparing what classmates and peers have done and be able to look at the whole group as an entire aggregate of papers. The other thing is that I won't have put aside that time in order to grade. Just because you submitted it early doesn't mean I've got the time to grade it early. The papers will be graded, but they won't be graded before the due date. And I'm very, very good about grading papers and getting them back to you on time. So that shouldn't be a problem. If you have any problems with that, if you think I'm taking too long on something, reach out to me, let me know. Okay, our quizzes, we'll talk about those in a minute. I'm not going to go over those here. Okay. So that's the end of the syllabus. Now let's just go into the schedule really quick. Your schedule looks like this. This is the way most instructors at Concordia are doing it this year. It talks about what do you need to do before class, what do you need to do during class, what's after class. Now, I'm not asking the people that come to class on Monday to have all of their work, all their pre-work done on before Monday, and then people come on class on Friday, oh, they get to wait until Friday. We're not going to do that. You have until the end of the week to do all of these activities. But you might not want to wait till the last minute because there is quite a bit to do that's going to take time. In other words, if you're watching an hour of video, try to figure out when you're going to fit that in so that you can actually sit back and watch that and glean the information from it that you may have gotten. But the activities that we do in class, because I've got to do this split class, the activities we have to do in class are not going to be dependent on you having completed something unless I tell you about it. Unless I specifically, I think there's one that I want you to complete an activity sheet before you come to class because that's what the discussion is going to be on. But I'll be very explicit about that and letting you know. So the specifics will always be on Blackboard. And then I will record our sessions just like I'm doing today, and I will post those on Blackboard. I'll just record Monday. I'm not going to record both of them. They're both the same lesson. But if you have to miss a face-to-face class because you're sick, we don't want you coming to campus if you're sick, right? You're sick, or you're in quarantine, or somebody you know has, you think you have an exposure, right? And they've told you to self-isolate for a while. That way you can watch that Monday class and glean the information from there. So I will tape the Monday classes and I will post them up there. It should be pretty explicit on here about when you are in Zoom class and when you are attending face-to-face, like next week, week 2. I will have sent you whether or not you're in the Monday or Friday group, and then I would expect you to attend face-to-face on that particular day. And then on weeks, this is one of those examples where I said, if we can't meet on a Monday or a Friday because of a holiday or because the school is closed, then I have to do a Zoom session, the second class, because I have to have everybody involved. I'm already losing a lot of weeks, half the class session. So when we have Labor Day, we won't meet on Monday. We do have IPE for the junior ones. You get more information about that later on. Not from me, you'll get it from Sam. And then Zoom, or Michael, Zoom information, Zoom session for all on Friday. So that's just an example of that. So this tells you about what your post activities are, and then you'll look for Blackboard for these activities. I've put the major ones in here. By the end of the week, I will send you a code for your virtual simulations. Virtual simulations is not something you need to purchase. We can't use the one that they're using in other nursing classes because they haven't developed, the company Lippincott hasn't developed community health for that particular product yet. They don't have any community health ones. So I've secured for you virtual simulations through Lippincott, but it's a completely different thing. It's called Touchpoint, I think. And I'll send you, you'll each get your own sign-on code, and then we'll use those for our virtual sims. We're going to do 3 of those virtual simulations during our theory class, and then we also have ones then we could use in case we would have to go completely virtual for some of your clinical classes in 341. Okay, so I'll send that to you. So I've got information here too about dates on the final. Historically, our final has been Monday morning, the week of finals at 7:30 a.m. I don't choose that schedule. That's from the university. It wasn't something I choose because I'm not a 7:30 a.m. kind of gal, but that's usually when it is. So when we get the university schedule, we'll see what it is. It will be online and it will be with respondents like I talked about. We can talk about that later as we get there. And then at the end of this, I've got your reading list. If you're a junior 2 and you're an ATI, this is going to be your reading list. And then if you're a junior 1s and you've got Kaplan, this is your reading list. I'm not checking those reading lists, but this is what prepares you to take those tests. So I'm giving that to you as a suggestion on that. This is kind of the content that relates to community health. ATI, actually, if you're an ATI person, you actually have a book I've got a copy of it. If you don't remember that you have a book, let me know, and I'll send you a picture of what it looks like. And then Kaplan people, you have the two books. You've got the basics and the review. And they're kind of more concept based. All right. Let's stop sharing. Any questions on our syllabus or our schedule?
I have 2 questions.
Yeah, Ashley.
So I am one of the Portland students, and there's 7 of us, and we're
Uh-huh.
seniors. We're seniors, so should we just use ATI?
My understanding is that you are using ATI.
Okay.
Yep. Have you gotten books already?
Yes. Yeah, they gave them to us. Yeah.
Okay, then, and it was ATI, right?
Mm-hmm.
Yeah, go ahead and use ATI. You just follow the ATI list. Don't worry about the Junior 1, Junior 2 thing.
And then if you are like in face-to-face Monday, then Friday, do you not have to like attend class? Do you like do your activities during class time?
And that's a suggestion. That would be really good practice, actually, because you've got that hour and 20 minutes that you don't have blocked off. And if you want to stay on top of things, that's what I would suggest.
Okay.
And vice versa. If you're on Monday, then do them on, if you're on Friday, then do them on Monday.
Okay. So, but nothing to attend, just 1 day a week.
Yep. On those weeks, some
Okay.
weeks we may do Zoom both Monday and Friday.
Okay.
Good questions. Anybody else? If you're raising a hand, I might not see you because I've got more than one screen here. So are we good? Okay. All right. Now we're going to go back. I'm going to pull the PowerPoint up again, and we're just going to kind of touch on some of the highlights to make sure we're covering everything I wanted to cover. Okay. All right. So we went over the syllabus. We went over the schedule. We went over, here's the book. This is the ATI book. If you don't remember what it looks like, this is the one for community health, RN community health nursing. So we talked about this, about how you've got the 2. Let's talk about some class assignments. All right, so this week you have a pre-class knowledge check. That is going to be utilized later on in the class. So what I like you to do is just take it off the top of your head. I'm not expecting you're not getting it graded. I'm not expecting you to have correct answers on everything. I honestly don't care. I'm going to use it though to see what I need to concentrate on that maybe people don't have a really good grasp of coming into class. One of the things that can be really frustrating is if you have somebody lecture you on something that you already know, and you're just like, I know this. But I will look at what the whole class needs and make sure that there's adequate instruction for those, whether it's viewing a video, whether it's reading an article, or whether it's through a lecture. Then you have 10 post-class assignments. Those are just to make sure that you've paid attention to what's happened during the week. They really shouldn't take you too long. I'm not looking at any of them being more than 1 or 2 pages. Some of them are only 1 sheet. Some of them are multiple choice. Some of them are reflection papers. I'm not looking for formal type of formatting, other than if you cite something, you should list what the article was. You need to give credit to the author. So you should be able to, at least at the end of, if you've cited somebody or you've had to pull information from something, you should be able to list at the end of whatever you're doing, whatever document you've got, whether it's an activity sheet or whether it's a reflection paper or what. Go ahead and mark on there where you got that information. That is to protect you from being accused of plagiarism. And so that always happens. You always want to cite your work. Okay.
What day of the week do you want those turned in?
Those are all turned in by the Sunday before midnight, the last day of that week.
Okay.
Okay. And I would suggest that you don't do them. I know some people like to get really ahead. I'd suggest you don't do them. You could do them ahead of time, but what you run into is the fact that you may not have gotten the information yet to complete it if you do them too far ahead of time. So, you can take them when you feel like you've mastered that information. But yeah, it's Sunday at midnight. Okay. All right. Then we have one online module. This is by the Wisconsin Public Health Nursing Association. It's actually the Wisconsin Health Nursing Model. It is a webinar, a recorded webinar, so you're just going to be watching it. And then you take a short quiz afterwards, and then you get a completion for that. So that shouldn't be too much work. If you run into any problems with that, of course, let me know. But that's worth 5% of your grade. And then we're going to play actually a fun game. We're going to play a game called Solve the Outbreak game on CDC. And it actually is about taking you through different scenarios. It's pretty well written. Taking you through different scenarios, and there's a ton of them, on what you would do for different outbreak situations. So pretty relevant to what we've gone through. And so there'll be instructions on how to play that game, but you get 5% of your grade for completing that, turning that in, taking a screenshot of it and turning it in. Then we have a global healthcare assignment. This is one that's actually due the 3rd week, so you'll want to pay attention to this. I should have, let me look on Blackboard. I think I've got it already posted on there. Okay, this is a student view. This is what you see. I'm in the content section. Jacob, can you nod your head if you can see this, that I'm on Blackboard? Okay, thank you. And so under week 3, if I click on week 3, I've got the Global Healthcare Systems Assignment and Rubrics. This is due week 3. This is actually what used to be, unfortunately, it used to be a, I'm going to move this over to my other screen. It used to be a group project, but we couldn't do that this term because I can't group you. I mean, you used to get together in groups and do it, but this is what it looks like. Your objective is to learn about the healthcare system in the United States compared to another country that has a healthcare system. And so it gives you Australia as an example. And so it's just, as you can see, it's just kind of summative information in these areas under what is the access ability for healthcare for people? Can they get access to healthcare? What are the costs? And this one has to do with really, what does it cost me as a consumer? How much does it cost me to have this healthcare? And then this one is finance. How is it actually financed by the government or by the private sector or whatever? Administration, how's it administrated? What are the benefits that they get and what's the quality? You're going to see that it's a lot are very, very interesting and much different models than what we have in the United States. Then you're going to do that on the United States too. And then you're going to give 3 rationale on which country you would rather live in, you know, why. Which one would you rather live in? Let's say you chose France. And so you did France, and then you did the US, and now you're going to tell me, well, I chose France because of these 3 reasons. And then here is a couple of good references just to get you started. You should be able to find others, but there's good references on here. This is actually due the 3rd week. This one's going to be due, it says in Blackboard, it's going to be due by Thursday, because that is a day that we all meet via Zoom on Friday. And during that class, I'll put you in breakout sessions and you'll share with your peers what you found out about your particular country. So this is already on Blackboard. And you should be able to then see it under content and under week 3. These weeks in Blackboard will roll out as the semester progresses, but you'll be able to find it under here. And then when we get together in our breakout groups, and it says here Thursday, 9:10 before midnight. And then when we get together in our breakout groups and you share, then you'll just be filling out a simple summary document. I listened to what Jacob and Ashley and Honey all had to say about their countries, and this is the countries they did, you know, that kind of thing. Just a little summary document. All right. So that's the global healthcare assignment. That's worth 10% of your grade. The 3 virtual simulations are worth 10%. Those are pretty self-explanatory. We'll talk about them a little bit more as we get into those. They're not hard. They usually take about an hour. You're going to take a quiz afterwards. I just want you to pass the quiz with an 80% or more. Just take a screenshot of all this instructions in Blackboard. Take a screenshot of the quiz that you got an 80 or better and post that as your completion assignment. One's on a public health clinic, one's on a windshield survey, which again, we used to do as a group project. We can't anymore. And then the other one, actually I think the most enjoyable the students said last time was the disaster drill. It's a train versus a bus accident, and you happen to be there and you're triaging people. When we get to that section, we'll talk about how it's different to triage people in a disaster than it is in the emergency room. It's completely a different process because your goals are different, and so we'll talk about that. And I'll send you those codes later this week. And then we have 3 quizzes. The quizzes are all open book. They are online. They are multiple choice. And they are open on a Friday, and they're not due until Wednesday. So those dates are in your schedule, and you get to submit them as many times as you want. I take that back. I think I limited it to twice, and we take the highest score. Last term I did it as many times as you want, and students actually found that was distracting to them because they kept trying to get a better score. Each one is worth 5% of your grade, so the total of the 3 quizzes is 15%. They're about 25 questions. It's just, again, making sure that you're paying attention. There isn't really a time limit on taking that. Talked about ATI or Kaplan, so there's that final exam, community health exam. You need to take in both of those. That's worth 5% of your grade. We'll talk about that as it gets closer, that you get points for remediation, which is when you go back and you look at what you got wrong and work on things to be able to spend some time on those, and I can see the time you spent and things like that. And then the final is worth 20%. That is the one that we will do on finals week. It is multiple choice. It is online, and we need to do it all together. You have 90 minutes to complete that. Again, all these instructions are in Blackboard. 90 minutes to complete it. You only get 1 chance at it. But if you've been paying attention during the course, you shouldn't have any problem with it. Okay. And then we have one more thing, and that is the student weekly reports. So after we divide out the students and we look at Monday and Friday, each week I would like one student to talk about what's going on with COVID right now. What's the update this week on COVID? And one student to talk about nursing specialty that happens to be in community health, and there's a ton of them. So we'll talk more about that on Friday, but you won't have to do both. They're not graded. It's very informal. I want you to talk to me like we're talking right now. I just want you to say, you know what, this week in with COVID, we found out that Dane County decided as a county that they were not allowing any elementary schools to start in person. They all need to start virtually. And some of the schools, including this one and that one, are protesting because of that, because they were all set to go. They were all set to go face to face, and now they have to start virtually, and that's been a real problem. So something like that. Or you may say, you know what, the World Health Organization just came out with new numbers this week, and XYZ, the numbers are XYZ. And here's a graph from it, or something like that. That could be for COVID. For the nursing role, you may say, yep, I looked up, Indeed's a really good spot for looking up these nurses roles. You say, yep, I saw an opening for a corrections nurse, and this is what it talked about having to do for the corrections nurse would have to do, somebody working in a correctional facility. That's community health because it's dealing with the aggregate of a vulnerable population, which is inmates in a jail or a prison. And you could talk about that a little bit. You could talk about a school nurse. You could talk about occupational health nursing. I mean, there's many, many, many. So you only have to do one, COVID or a nursing role. I'll assign it to you. I'll assign the date to you. It's very informal. You don't need to put together a presentation or anything like that. If you're doing the specialty role, look a job description up that hasn't been done yet. If you're doing COVID, just look on CDC or the World Health Organization or Wisconsin Health Department, Public Health Department, or Milwaukee County Health Department, or whatever, and find out information. It shouldn't be that hard, but it'll be better than having me talk about them every week, which I get tired of my own voice, and you guys will get tired of my own voice. So I'll be happy to share that a little bit with you and allow you to have a voice in that. Okay, So that is in a nutshell what community wellness is going to look like for us. This is the theory part. You obviously have the clinical part. I think Portland students aren't taking clinical until the spring, so we'll work that out when that happens. For the clinical part, 2 of your groups are in schools, and those will continue. We think right now those are going to continue even if we go virtual, because health education still needs to happen in the schools, and so your adjunct faculty will work with you on that, Sue and Melissa. And then we have the Voice of Nursing, which is a brand new program that Concordia has partnered with Fresh Meals on Wheels and the Aging and Disabilities Resource Center on reaching out to isolated seniors in our area because of COVID, and it has started with phenomenal results. Phenomenal results. In fact, one gentleman who was participating in that, one of our clients said to the nursing student, "You're the daughter I've been looking for 91 years." Oh, how wonderful. But these people have nobody reaching out to them, and we've been a lifeline to those individuals. So a very meaningful endeavor as is student nursing. So, okay, I'm going to open it up to questions now. What questions do you have for me? Well, I did such a phenomenal job. Nobody's got any questions? You have to have a question. Come on. Does it look pretty clear then? You're good? All right. Okay. So if you're okay, then I will send out the survey to you about the Monday and Friday. Think about that. And please, if it doesn't matter to you, please let me know it doesn't matter to you, because obviously it's going to be a challenge trying to get our groups equal. I will also, by the end of the week, send out the virtual simulation codes, but I'm shaking my head because you don't need them right now. But I'd like to get it off my plate and then allow you to sign in so that I know there's no problem. So when we're ready to do a virtual simulation, we're good with that. These are a little bit different than the other ones that you've done in the other classes. And then I will post my cell phone on Blackboard on the same box that I've got Zoom, just so it's easy to find. And then my promise from you, what I'm asking from you, is that you reach out to me for questions or things that aren't clear or things that I may have said it. Believe me, I know I can say something one day and then the next day I say something different. It's just because that's just me. So if I say something on, one day and then next week I say something, you go, oh my gosh, that's not what you said last week. Please call me on it. We're in this together. I want you to be successful in this class, and I want you to be successful in school this semester. So let's pray for each other. Let's give each other some grace, and let's be there for each other as we get through the term, okay? Okay. All right. So I'm done, unless there's anyone who wants to stay after and talk to me a little bit, but you can go ahead and sign off, and I will see you same place, same channel, right? You guys didn't get that because you're not as old as me. They used to say that about some of the TV shows. Same place, same channel next week. So it's on Friday. Friday, I will see you at 12:05. I will be here about 5 minutes to 12. You can sign on then, 12:05, and we'll have our first lesson. Okay? Okay. Thanks. Bye.